Chet, one of the struggles that we see is a disconnect between efforts to make improvements on the front line in the clinical areas and in the support areas and the executive level or level down below. A lot of people feel that either they're not supported or the executive team doesn't understand. That's not necessarily true, but getting executives to be down and be visible, getting the C-level down and visible on a regular basis is a real challenge.
The one thing I see, Chet, is that as the new healthcare law rolls out in 2014, and the organizations are going to have significantly more people in the system, they're going to have to really step up the performance of the value streams within the hospitals. And I think if they're able to handle this new influx of patients that are coming in, they really have to get serious about implementing Lean in the near future.
The problem is that if they don't carefully define the problem, they end up trying to implement solutions that don't really match the problems because they haven't spent enough time trying to clearly define the problems. I think, as you know, our model of PDCA now has attached to it a triangle at the top that says grasp the situation, which really encourages people to go look, go see what's happening and make sure they have a clear understanding of what the problem is, not just what the symptoms are.
And there's what we find initially when we start to talk that concept is people all of a sudden realize, I really just do jump to solutions, and I've got to slow down and really understand what my problem is before I come up with a solution. Well, the book is a result, at least it came out of some work with the Michigan Hospital Association over a 3-year period. And in that particular work, we tried to spread Lean over 65 emergency rooms over a period of 7 months in a collaborative fashion where people would learn, be able to socialize it, and be able to spread it within their organizations. That's the work that came out of that then resulted in a book that kind of lays out that process and that flow. And Judy, I think there's some more benefits beyond what happened there.
I would say really it's a book about the methodology of value stream improvement, and it's designed, although it was specifically written for healthcare, and the examples we use in there are healthcare examples. Any leader who feels like they want to undertake a value stream improvement effort, and that's from scoping out a project for improving a performance to figuring out all the way through what it might look like after it was redesigned, to how they're going to get there, to setting up a management system ultimately at the end of the process. We'll walk them through step by step how to do that with very practical advice.